Live from 12 News, this is Breaking News.
It'll be our last COVID press conference of 2020. There's been a lot of them, and thank you all for tuning in week after week, day after day. It's been an enormously difficult year for everybody, and I want to thank you for hanging in there, and I want to thank you for tuning in to keep yourselves informed. It has been a big part of the reason we have been able to be effective in fighting coronavirus. I also want to give a special welcome to Dr. Nicole Alexander-Scott, who is feeling terrific and is out of isolation. Welcome back. Good to have you. And also to Director Brett Smiley, who is feeling terrific. He tells me he went running yesterday, and he's feeling great, and he's out of isolation. So welcome back. It's great to have you guys. Dr. Chan was not able to be with us this afternoon. He's going to be our regular person to update us on the vaccine, but today Dr. Alexander-Scott will go ahead and do that. So as a reminder, no press conference next week. As I said, this is the last COVID press conference of 2020, and then I'll be back here on Thursday, January 7th at 1 o'clock for the first press briefing of 2021. I also want to thank the members of the press who are here. You have next week off, at least from this press conference. You guys have been incredible. You were here every single day when they were 7 days a week, and you've been here every week since then, and I know you got a tough job, so I want to thank you all for being here. I'll try to keep it a bit shorter today. I know it's a holiday season and we're busy, but nonetheless, COVID is with us, so it's important that we stay informed and stay vigilant. Let's begin with the data. Please put the slide up. As we always do, yesterday we had 880 new cases out of 12,000 tests, so that gives us a percent positive of 7.1%. And very sadly, another 8 deaths. My heart goes out to Rhode Islanders who are losing loved ones, especially now, a week before Christmas, a week before the holidays. It's been a brutal year, and so if you have a loved one who has passed, or you have a loved one now who's struggling in the hospital with COVID, our thoughts and prayers are with you, and we're doing everything we can, and God bless. I want to draw your attention to the new data that we're tracking daily, which is the exciting piece of data on that slide, which is the vaccines that we've administered. As of today, 6,400 Rhode Islanders have received their first dose of the COVID-19 vaccine. Obviously, we have a long way to go, but that's exciting. Over 6,000 Rhode Islanders have already received the vaccine. We're vaccinating people every day, every week, every month going forward. And as we look to 2021, we are assured by all the manufacturers of the vaccine that they're going to really start to crank up their manufacturing in January and in February and in March. So we're on our way now. This is the beginning of the end. The vaccine is effective. It is here. And come next year, we're really going to start ramping the vaccinations. Another data point that gives me hope and relief is the percent positive rate. I have a bit of relief looking at that percent positive, that it's going in the right direction. We want to see it at 5% or below. We are not yet at 5% or below, but we've turned the corner. We have turned the corner. A few weeks ago, I was up here and we were flying up the curve, 8, 9, 10% positivity, and now we're coming down. So that is because of the pause. It's also because we're doing more testing and because our contact tracing is getting better and faster. We don't have a backlog anymore. But to those of you who paid really close attention to the pause, which was most people, thank you. It worked. And we're seeing terrific results in saving lives, seeing our hospitalizations plateau, still overfull, but plateauing. So it's, it's a significant improvement is what I would say. For the past few days, we're hovering around that 6% test positivity, and that is a very significant improvement from where we were a month ago. And it's a much safer place to be. And so again, thank you. Thank you for hanging in there with the pause and following the rules. It turns out it was the right call, and it's been very effective, and it's just allowed us to stabilize the situation. As I said, we're not out of the woods. We want to get to 5% positivity. We're not there yet. But if we continue to be serious about following the rules, we can continue to stay on this good curve and be in a stable situation. So what that means is, although we've lifted the pause, over the next few weeks, we just need everyone to be careful. We cannot just flip the switch and go back to life as usual. Again, it's a slow dial. So the name of the game for the rest of the year through the holidays is protect your household, stick with your household. Stay with the people you live with. If you want to go out to dinner, fine. Wear your mask, wash your hands, follow the rules, dine with the people you live with. If you want to go shopping, wear your mask, get tested at one of our pop-up centers, go with the people you live with. That's the whole name of the game. Christmas Eve, Christmas Day, New Year's Eve, New Year's Day. Stick with the people you live with, and find other ways to communicate with your loved ones safely, but don't gather indoors with people you don't live with. That's the name of the game, which is hard, but it's effective. And of course, just be vigilant about mask wearing. I have a very specific ask for everybody in Rhode Island, in addition to that. Make a plan to get yourself tested twice between now and the end of the year. If you're a person who celebrates Christmas, get yourself tested before Christmas and after Christmas. It's just kind of a good way to think about it. We are really ramping up our testing. At this point, there's no excuse not to get a test. You can go on the portal.ri.gov. We have plenty of capacity in Wickford, here in Providence at the Dunk. Go to Warwick Mall, there's dozens of pop-up sites. Go get tested. It's free, it's painless, it's quick, and you'll know. Because if you're positive, we need you to quickly get into isolation and tell all your people you were near that they need to go get tested. So make a plan 2 times, everybody, before the end of the year. And as I said, stick with the folks you live with. Dr. Alexander Scott's going to talk more about testing in detail, but I just wanted to give everybody like a simple, concrete, life-saving thing that you can do between now and the end of the year. Since this is our last press conference of 2020, I thought it would be appropriate to give a very brief update of how we have spent our federal CARES Act funds. You will recall that in the thick of the pandemic, Congress took swift action to pass a federal stimulus relief bill. And I want to thank our federal delegation, Senators Reid and Whitehouse, Congressman Cicilline and Langevin. Amazing, all 4 of them in touch with me constantly. I can't thank them enough. In any event, because of their hard work, Congress passed the CARES Act, and Rhode Island received $1.25 billion of critically needed relief. And at this point, we've allocated all of that. And so I thought it would be helpful to take a few minutes to just explain where we've allocated the monies. Obviously, there's an extremely detailed list of how we spent every penny. We have a portal, and we've had numerous hearings before the state legislature. So if you desire great detail, you can go there. But give me a second to take you through how we've invested the $1.25 billion to get through the pandemic. And I'd ask you to please put the slide up that goes through the breakdown. So we spent it in the following big areas. First is to the COVID public health response, first and foremost. Testing, contact tracing, vaccines, et cetera. Second, business and economic support. One of the hardest things about this is we've been dealing with 2 crises at the same time. An economic crisis that has put tens of thousands of Rhode Islanders out of work and small businesses on the brink, and a public health crisis, and often their intention. So we've put money out to business and economic support, individual supports, helping people with food, cash assistance, housing, education support. Big thank you to everybody who's been a part of K-12. Be proud of your work. Rhode Island is setting the pace for how we've kept our kids in school, and we've allocated money to cities and towns for that. And then municipal support and COVID-related state government operations to all the police, firefighters, DOA, public health workers, so many social workers, et cetera. We've used some of our money to meet the immediate needs of the crisis. And it has been a challenge. So again, you can see the information in front of you. I want to focus on two particular areas. The first is the $130 million that we've spent on our direct COVID health response. So that is $23 million in our field hospitals, which we are using right now, $6 million in contact tracing and case investigation, $24 million on PPE, so that's ventilators, N95, gloves, face shields, masks, which we've gotten out to nursing homes, hospitals, the National Guard, $33 million on testing. Rhode Island continues to lead America in testing. $44 million on community mitigation and other direct healthcare responses, particularly in the hardest hit communities, Central Falls, Pawtucket, areas of Providence. We've also spent nearly $500 million on business and economic support. About half of that money went to hospitals to ensure that they could keep their doors open and their employees employed at the height of the crisis when we asked them to shut down and their revenue fell off a cliff. And we also spent more than $125 million in direct support to our local businesses. So that's and I have Commerce Secretary Pryor with me today, who's been outstanding in his leadership through this crisis, and I want to thank him. The other states in the region call him for advice. That's the Restore RI initiative, Take It Outside, the Pause grants, the art and culture grants, et cetera. We've dedicated, more than 10% of our CARES Act money to helping struggling small businesses. And, here's what I would say. We've spent, a lot of people have been asking me, how do we match up with other states? So we've spent more than 5 times as much as Connecticut per business, and more than 15 times as much as Massachusetts per business. Having said that, I will be the first to say it's not enough. I have been trying to be out and about, shopping local and keeping my ear to the ground, talking to small businesses, restaurants, bookstores. It's brutal, it's tough, I'm sorry if your survival is the name of the game. But we have tried to use every penny that we could of our CARES Act to help you get through it. I know it's cold comfort to know we've done better than other states, but I hope you'll accept it as evidence that we really care about our small businesses, and we're going to get through it. 2021 is around the corner, and it's going to be, let's make it the best yet, particularly next summer. I think we're going to help you do everything we can to really make up some of the lost revenue from this year. We also set aside $45 million for the Back to Work initiative. You might recall that 6 months ago, I launched a Back to Work job training and job placement initiative using $45 million of our CARES Act. The Back to Work was designed specifically to reach out to Rhode Islanders who had lost their job due to COVID and who were at risk of being long-term unemployed. Maybe they're in an industry like retail, like hospitality, that's going to be struggling for a long time. Maybe their skills were a little bit outdated, and so they needed some job training in order to get a different job. So we said we're not going to leave those Rhode Islanders behind. We were going to dig in and be there for the people who had lost their jobs. And we did it with an eye towards equity. We said more than half will be women, about more than 25% will be people of color. And I'm thrilled to announce today that by the end of the year, by the end of next week, we'll be on track to have more than 5,000 Rhode Islanders who are out of work due to COVID, trained, supported, and matched up with a job. That's incredible. That means the Department of Labor and Training, working with Commerce and my office, they've established in just a few months 130 different training programs, and nearly 200 businesses have hired back-to-work participants. We've also, throughout that, provided help for folks who were getting the training. You can't put your life on hold while you go get trained. So we've provided housing help, rental help, childcare, transportation. I am so proud of the 5,000 people who had the courage and strength and determination to pick yourselves back up, get trained, some of you mid-career, mid-crisis, and get a job. And I'm super proud of my own team. Scott Jensen, who is our Director of Labor and Training, is a miracle worker in my estimation, and he and his team have worked literally every day for months to make this a reality, so I want to say thank you. We're not stopping, by the way. We'll get 5,000 by the end of the year, which is our goal, but the business partners have pledged already up to 7,000 jobs. So at a minimum, we're going to get another 2,000 people placed. But we're going to keep going because it is such a successful program, and people deserve a chance to get trained and get a job. If you're a Rhode Islander out there who is out of work, who's hearing me talk about this, go to the website, backtowork.com. Check it out. It's free. I'm not going to say it's easy because you have to go through the training and you have to graduate. But it's free and it's effective. We promise you, if you graduate from the training, you will get a job. So if that sounds good to you, then go to Back to Work RI and sign up. I want to end in the spirit of the holiday for a few minutes with just some thank yous. If you're one of the lucky ones who hasn't lost your job during the crisis, that doesn't mean you've had an easy time. Pretty much no one is having an easy time. Folks who've lost their jobs are struggling like they never have. But folks who've kept their jobs, many of them, have had to work harder under more stressful circumstances than they ever thought they would ever have to or ever thought that they could. And it's put enormous strain on them, their own health, their families. And I want to pause for a minute to say thank you. I in particular want to thank a lot of the public employees who've had to step up since March. Public employees don't always, you don't know their name, you just hear the state or the city. But they're people too. They're Rhode Islanders, friends, neighbors, working their tail off in the past 8 months to help Rhode Island get by. So I want to, as your governor, say thank you to every single public employee who's pitched in and worked so hard this year. There are so many unsung heroes, and I could be here all day listing them all. Mercifully, I will not do that. But take it from me, there are thousands of unsung heroes. Custodial staff. Every Friday, I work late on Fridays. I leave my office, and there's a crew of custodians waiting on a Friday to go clean my office. With no recognition. They don't expect any. They just do it. And you see all around custodians in hospitals, in the state hospital, everywhere. It's a really hard job on a good day during COVID. Indescribably difficult. The teams at Commerce, they don't get a ton of credit. They have been working endlessly. DBR, nobody likes it when the inspector shows up at your restaurant, let's be honest. But they've done it. They've done it nights, weekends, 7 days a week, with grace, with patience, and with an eye toward helping you out. Not a gotcha attitude, an eye towards let's help you to be in compliance. the staff at DEM, who've been helping Rhode Islanders take it outside, the team at EMA, who had a stockpile of ventilators and masks and who got it out, even when the federal government wasn't there for us. Our team got it done. Our IT team, I've been up here forever talking about Crush COVID and the texts that you get when you get a positive test or when your test results are ready. That didn't exist. We had to, our IT team had to create that from whole cloth, and they've done it. And they've done a beautiful, beautiful job. To everybody who volunteered their time on weekends and on holidays to keep people safe, we couldn't have gotten through the year without each and every one of you. I would venture to say, before this crisis, the average Rhode Islander probably didn't spend a lot of time thinking about the Department of Health or their work. A lot of people have said to me, I didn't even know the state had a health lab. Well, we do. By the way, it's not in great condition, and we need to invest to rebuild it. But I want to do a few shout-outs. Adam Miller and Christopher Harmon, they've been working there for years in the State Health Lab. We didn't maybe know that, but they've been there. Their lab, they are two of our lab supervisors at the State Health Lab, and they were some of the first state employees to serve on the front lines in this crisis in February when we didn't know what was coming at us. Adam, Christopher, Dr. King, all the folks at the health lab have risen to the challenge over and over and over again, providing us timely and accurate test results. So I want to say thank you. I want to say thank you to Imelda Benitez. Thank you, Imelda. Imelda spent hours. She works at DLT. As you can imagine, Department of Labor and Training has been totally overrun. At our peak, we had 200,000 unemployment insurance claims. She's been a dedicated employee. She told us the story of she spent hours on her own, not because anyone made her or told her, helping a caller who was having issues with her computer. So thank you for going above and beyond. She knew the person on the other end of the line was stressed out of a job, and who hasn't struggled with an old computer and broadband? And so Imelda took the time to hang on the phone for a couple of hours so that person could get their unemployment check. I have to thank Mike Manning from the Rhode Island National Guard, who stepped up to create and lead our command center for K-12 education. I want to thank Major Katie Tracy, also, who has been in the command center and who's overseen the purchase and distribution of more than 6,000 air purifiers that we are putting out all across the state in classrooms to keep our kids and teachers safe. When I went to them and said, guys, we're going to do a command center, no one knew what that meant. No one knew how we would do that, but they did it, and they figured it out. It's fantastic, and it's operated 7 days a week since the summer, and it has kept thousands of children in school and given them a chance. So I want to thank you. I also have to say a special thank you to the folks at DCYF. I talked yesterday to Kevin Aucoin, who's doing a marvelous job running DCYF. You know, look, DCYF deals with the most challenging situations in Rhode Island on a daily basis, on a good year. The holidays are a stressful time for a lot of families in the state's care on a good year. Now add COVID to that. Add the fear of social workers who've had to go into homes throughout the crisis. Add the fear, anxiety, and financial distress that's happening in the community that the vulnerable families of Rhode Island bear the most. I wish I could thank each and every one of you. You've done an extraordinary job, but perhaps no employee has driven the mission more than Betsy Aubin. Betsy's been a key leader at the DCYF's peer support team, which is a vital mental health resource for DCYF staff who are in need of support. And she's also spearheading race equity training for the department. That's pretty incredible. You know, the social workers and caseworkers and lawyers at DCYF are there for the kids, but they need support too. So I want to thank you, and I especially want to thank Betsy for being there for our own team. I could go on and on, as I've said. There are thousands of unsung heroes, and I just want to say thank you to each and every one of them. And I suppose I want to drive home the point to Rhode Islanders that this has been a brutal time for everybody, but those who have been lucky enough to keep their job have had a tough go of it too. And so on behalf of Rhode Island, to all public employees, state and cities, I want to say thank you. So finally, I'll just wish everybody a happy holiday. I will say it's a different time of year. It's a different kind of Christmas, different kind of Hanukkah, different kind of Kwanzaa, different kind of New Year's. It feels a little bit lonely. It feels, you know, not like anything we planned, not like anything we really would want. But I would say, you know, when we, you know, my family and I celebrate Christmas, it's about loving. It's about finding the light in the darkness. It's about holding on to hope. And it's about taking care of others in need. And that's all alive and well in Rhode Island. We did it, Rhode Island. We made it to the end of the year. And by the way, we're in a stable place right now. Millions of times over the last year, Rhode Islanders have come together, pitched in, made donations, looked in on a neighbor, helped somebody get food in quarantine. We have found the light in the darkness. We have found the space in our lives. And we have dug deep to figure out a way to care for others even when we've been struggling. So my wish for all of you is a very happy holiday. Yes, it's different. Yes, you're going to have to innovate. Yes, you might have to Zoom instead of seeing somebody. Yes, you might have to go visit and wave from outside. But it is a holiday nonetheless. And I just want to thank you all for giving me your support this year. I want to wish you a very, very happy holiday. And in my family, we know it's going to be different, but we're excited. We're going to make the best of it. We're going to have a good time. And we are really looking forward to a healthy, prosperous, safe 2021.